My name is Dr. Mandy Hathaway, and I'm a hematologist oncologist here at UCBC. February is Cancer Prevention Month, and so today we're going to talk about all the things that we can do to prevent cancer, just as a general overview. But first, let's talk about what makes cancer happen. Our bodies constantly make good, normal cells, and as part of that, those cells divide, replicate, and then die off. But sometimes DNA damage can happen and form abnormal cells. These cells just keep growing and dividing and growing and dividing and go unchecked and form tumors. These tumors then can shoot off other cancer cells throughout the body and spread other places. And that's how cancer can grow and spread. There are lots of different things that can cause this DNA damage, such as infections, inflammation, UV radiation, toxins, and a multitude of other things. Here at UCBC, we want to tell you the things that you can do to limit these things that cause DNA damage to your body. So first, eat healthy. A healthy diet plays a huge role in cancer prevention. There was a 2021 study that showed that people who eat 3 servings of vegetables and 2 servings of fruit a day limit their risk of death from cancer by 10%. Other studies have showed that vegan diets decrease the risk of cancer development by 16%. But what we do know is a diet high in fruits and vegetables, low in red meats or processed meats, and low in sugary, sweet things significantly can decrease cancer risk. Next, get active. Exercise plays a vital role in prevention of cancer. We know that 300 minutes of exercise a week can decrease the risk of certain cancers by over 50%. But just doing that exercise by itself is not enough. We know that people who are sedentary also have a higher risk. So avoid prolonged periods of screen time and try to get active. Next, maintain a normal weight. It is estimated that in women, 11% of cancers, and in men, 5% of cancers can be related to being overweight or obese. Overall, there are 14 different types of cancers associated with obesity, including colon cancer, breast cancer, endometrial cancer, and liver cancer, just to name a few. Next, avoid all tobacco products. Tobacco accounts for 30% of cancer deaths, and it accounts for 80 to 90% of deaths from lung cancer. Smoking tobacco and chewing tobacco are both dangerous. We also know that secondhand exposure to smoking can increase the risk of cancer development by 20 to 30%. So avoid tobacco products. Next, limit alcohol consumption. There are several different cancers associated with excessive alcohol intake, including breast cancer, colon cancer, liver cancers, and head and neck cancers. We recommend a woman have 1 or fewer alcoholic beverages a day, and a man have 2 or fewer alcoholic beverages a day to limit cancer risk. And an alcoholic beverage isn't how much you can fit in a cup. It is 12 ounces of beer, or 5 ounces of wine, or 1.5 ounces of liquor. Next, protect your skin. Skin cancer is the most preventable cancer and the most common cancer. So it's very important to protect your skin from the harmful UV rays from the sun. It is important to protect your skin year-round by wearing hats, protective eyewear, sunscreen, lip balm, and long sleeves and pants. Next, practice safe sex. There are several viruses that can be spread through contact with bodily fluids that can lead to cancer development. Specifically, we talk about the HPV virus, hepatitis B, and hepatitis C. These are spread through blood, semen, and vaginal fluids. So it's very important to protect yourselves from other bodily fluids. Next, avoid toxic substances. We know that there are some chemicals that just increase the risk of cancer, including benzene, radon, and asbestos. So stay away from these. There are other products that when used in excess can lead to cancer development. So always take care when using cleaning products, pesticides, solvents, and paint. Lastly, get regular physical exams. It is important to see a healthcare provider at least once a year for a head-to-toe checkup. During this exam, they will check for symptoms of cancer, but also talk to you about necessary screening tests for cancer detection. Here at UCBC, we want you to do these steps and others to lower your risk of cancer development.